When I first started the PhD program, it was a little ways a shock because it was a form of thinking that is not easy for somebody who comes from a very black and white background. In nursing, you need to know this in order to be safe for this. And in the PhD program, you construct your own opinions, you construct your own challenging arguments. My name is Chelsea Kirker. I am currently a nurse anesthetist. My path to being a nurse anesthetist, I started as a registered nurse. I got my BSN. And then from there, I went to Northeastern to get my master's degree as a nurse anesthetist. And I'm currently pursuing a PhD at Northeastern as well. The process as far as a PhD, I knew that I wanted a PhD out of anesthesia school. So when I was looking at prospective jobs nationally in the country, including California, Baltimore, Texas, and Massachusetts, I was also concurrently looking at PhD programs. Northeastern in particular, as far as a PhD program, was alluring to me because it had the ability to do part-time. So I can work both full-time and do this part-time. Northeastern gives me the ability to both do hybrid learning, so I can do online classes as well as in-person classes. Based off of my interests, I could have done a PhD in psychology versus a PhD in nursing. And why did I do nursing? It was because of the population that I wanted to target. When we talk about nursing, it's oftentimes a caring relationship between the nurse and the patient. And for a long time, nurses have looked at specifically just the patient, and we've neglected ourselves. Because if a relationship is based off of two people, then why are we only looking at one of those relations? We need to start looking at the other in order to make that a more impactful relationship for everybody involved. And so I think one of the ways to do that is by bolstering the work environment. If I can help do that, then I do think that's a way towards bettering the healthcare system that we have. I think as nurses, we were put in a particular box of what we should do, what we're able to do, and how we can do it safely. And if I've learned anything from this PhD program, is that we have the ability to do so much more. So what's going on now in the nursing community, we probably have those answers. Like why, is there such a shortage? Why are people leaving the nursing floors? We probably have those answers because we're the ones experiencing them. I think a lot of people that do and pursue PhDs have this idea that they want to change the world. And that's how I started too. Like I want to change the world based off the lens I see it in. I might not change everyone's world, but I'll change some people's worlds.